We are now live.
All right, good afternoon, everybody. Good afternoon. It is a pleasure to be able to come before you all tonight. We have a great evening set up for you guys, and so it's a pleasure for us to be able to have Dr. Earl Stewart with us this evening. That's going to share some wonderful information. So one thing I want you all to do, if you have any questions that you would like for Dr. Stewart to address at the end of the Zoom, he's going to have a discussion and answer some questions then. But I want to just bring to the stage Dr. Earl Stewart Jr. He's in internal medicine physician. She's a BSN and she's with Encompass Healthcare. And so we're grateful for these two to be with us tonight. And so I'm going to turn it over to Lakeitha, and so we can and just join in from there.
Good evening, everybody. As Pastor Baker said, thank you all so much for joining us for this very necessary conversation with Dr. Earl Stewart. I know Dr. Stewart from Thomaston when he was in the Thomaston area for a little while, and we had a brief introduction, and I see him on Facebook, and we've chatted a couple times about some different discussions that we want to be able to bring to the people, because I think it's very important that we educate our people, because I don't think you can make an informed decision if you don't have all the information. And when Dr. Stewart and I linked up about this COVID situation, I thought it was very necessary because there's so much misinformation out there right now in regards to COVID, in regards to the vaccination. You got people saying they want to take it, they don't want to take it, it's been developed too soon, it's this, that, and the other. So I was like, why not bring on someone who, does the research and, they work in the area. So I'm sure that he'll be able to give us some information to hopefully help you guys make some much and have a more informed decision. So Dr. Stewart, like Pastor Baker said, he is a doctor in internal medicine. He is a very educated young man there. He's young, but he's very educated. So why not bring in the educated doc? So at this time, Dr. Stewart, I'm gonna let you take the floor. If you want to just give a brief overview on COVID-19, and then we'll go into the vaccine.
Well, Pastor Baker and Lakeitha, thank you both so very much for having me tonight to talk about a very timely topic, a very important public health topic that is the reason I really wanted to do this and to go through this particular avenue is to talk about it as it pertains to how the COVID-19 disease is disproportionately impacting our community, the African-American community. The latest statistic from CDC is that African-Americans compared to white non-Hispanic persons are 2.8 more times to die from COVID-19 and 3.7 more times more likely to actually be infected with the virus. So it is disproportionately impacting Black and brown people. And we definitely need to get the word out about the preventive tactics that we have available to us throughout our country to actually prevent the infection from spreading, the virus from spreading throughout our communities. So thank you both so much for having me. To talk a little bit about what COVID-19 disease is, COVID-19 actually stands for coronavirus infectious disease that was discovered in 2019. We all know that it originated and started to propagate initially in the Wuhan province of China. And the virus is actually the SARS-CoV-2 virus. And the reason it's SARS-CoV-2 is the SARS-CoV-1 virus was initially discovered in 2002 and caused the SARS epidemic, which we've all heard of before. COVID-19 disease is a little bit different, and the reason it has been referred to as being the novel coronavirus is because coronaviruses usually originate in bats. They're endemic to bats or have bats as the natural reservoir. And this virus in particular that's caused the global pandemic has developed the capability to transmit itself from bats to humans. And now humans have become the reservoir for transmitting the virus to each other and therefore causing the COVID-19 disease. So it is naturally an airborne pathogen. There are many different types of coronaviruses. Coronaviruses naturally cause the common cold. Uh, Rhinoviruses cause the common cold. Adenoviruses cause the common cold. Even enteroviruses have been linked to some cold-related symptoms. But this particular virus has developed the capability to do more than cause respiratory symptoms. That's its initial place in the body where it takes hold and causes pulmonary disease and some complications from that. But it also has the capability to cause a more systemic inflammatory response, where it has the capability to cause and basically a supercharge of the immune system. And you may have heard the term cytokine storm. All that means is that when this virus takes hold of various tissues and important organs, the heart, the lungs, the kidneys, it causes the release of chemical substances that have the capability of causing just systemic inflammation, which can lead to scarring and which can eventually lead to end organ damage. And that's what makes certain people really, really sick from the infection. Others have the capability to be infected with the virus, but they don't necessarily have symptoms. They're asymptomatic. We've heard of that. And those, I would argue, are some of the most dangerous individuals because they don't necessarily manifest symptoms, but they can transmit the virus to others. So those who usually have underlying conditions, those who are older, those who may have chronic heart disease, chronic lung disease, those who are maybe immunocompromised from having HIV/AIDS, cancer patients on chemotherapy, people who chronically take corticosteroids for conditions like rheumatoid arthritis or lupus are more susceptible to developing infection with the disease and therefore becoming sicker. And I would argue that those are some of the people that we see more commonly being hospitalized with, the respiratory complications of being infected with the virus. So, and we know in our community, in the African American community, we do have a higher propensity to have underlying conditions, heart disease, chronic kidney disease, have hypertension. There's been a lot published in the medical literature about obesity being an independent risk factor for being infected with the disease and potentially developing more severe complications from COVID-19. So it's definitely important that we spread the word about how to prevent this from definitely impacting our community, not only our community, all communities. But for the purposes of this talk, I definitely wanted to get the word out to the African American community, and particularly in rural areas, who are often disproportionately infected and affected by chronic medical problems, hypertension, diabetes, obesity in its various forms and fashions. So that's a little bit of an overview about the biology of the virus, how it takes hold on the body, and pretty much, I guess we'll talk a little bit more about what we can do to prevent it.
Okay. And before we move forward, if it's okay, I just thought of a couple of questions just to interject before we get too far into it, so people kind of have some information as we go here and there. So if you don't mind, Dr. Stewart, for us in the medical term, we know what it means when we say that the virus is airborne. Can you kind of explain to the people what that actually means in a way that they understand what airborne means when they hear that, this disease is airborne, and ways to protect themselves from that?
That's a great question. Thank you for it. So we in this part of the world have a lot. We're very hands-on. We're very out in the open. We have a lot of freedoms in the United States, and one of those freedoms is we have the ability to interact with people on a day-to-day basis, come in close contact with people, stand in front of people and talk to people. Airborne transmission pretty much means that the virus's particles, which are very minuscule, people call it an invisible enemy. But it can be measured and picked up microscopically. I think the actual virus particle is like 6 microns, which is extremely small. It's almost too small to even fathom. That transmits when somebody opens their mouth and just talks to you. They don't necessarily have to cough, don't necessarily have to sneeze. Certainly, sneezing and coughing will allow them to eject more of their respiratory contents into the air around you. But this basically means that you can be standing in front of somebody and talking to them, in close distance, and potentially, if they're infected with the virus, they can transmit the virus to you. So that's pretty much what airborne means. They don't necessarily have to touch you. Contact is not necessarily. So some organisms and microorganisms are transmitted by direct contact with infected liquids and infected substances, or a person who may be infected with the organism. But this is a type of pathogen that has the capability of being transmitted just by having a common conversation with someone, even in a public setting or a private setting. So that's pretty much what airborne means. And therein lies the reason why wearing masks is extremely important. Even though we have the advent of vaccines, we have to vaccinate. 50% I often tell patients, and I often say to people in common conversation about this virus, that 50% of our battle is getting people to get the vaccination. The other 50% was developing vaccines that we can administer to people. So wearing masks is still important. Physical distancing is still important. Until we are able to, everybody's been hearing this term herd immunity, which is a public health term. That pretty much means that, we want to get enough of the population in our country, enough of the population around the world vaccinated, so that those who are not vaccinated or who have not at that point yet received the vaccination will also potentially benefit from, being protected from infected with the virus. So herd immunity, you hear Dr. Anthony Fauci often mentions that we need about 70 to 80%. And they usually provide some timelines in terms of when we'll be able to achieve that. But that's why we have to get vaccinated. And that's why until that time, until we're able to achieve herd immunity, we still have to wear a mask. It's going to be very important. And I think that's going to be, I often call this virus the eternal virus, because it has taken a lot of what we're accustomed to in the United States and in our culture, and has made us rethink that in terms of our social engagement. And I really think even after COVID-19 and the coronavirus discovered in 2019 is long gone and long eradicated, hopefully it's, in the near future, we're still going to, I think, have something in place in our society where we're going to have to socially distance, where the mask may become a mainstay in terms of what we do when we're gathering, around people and in close spaces and inside to have gatherings and things of that sort. And you may, when you go to the grocery store, still see the markers on the floor to stand 6 feet apart from the person in front of you and behind you. So this is a virus that has really made us rethink how we engage socially. And we have to pay attention to that, I think.
I know, and you were talking about the mask, and we know, we hear people say, wear your mask, wear your mask, wear your mask.
Mhm.
But will you kind of say, like, can you kind of explain to the people, like, say, for instance, if I have my mask on, but you don't have your mask on, who am I benefiting from wearing my mask and you not wearing yours, if that makes sense? Like, you know what I'm saying?
Yeah, well, when you wear a mask, it is really showing a concern and a care for other people. Um, you know that they are really benefiting greater from you wearing your mask than you wearing your mask yourself. So it's important, and it speaks to the importance of wearing them because we need to basically protect others and our loved ones when we're around them. Nowadays, when patients are testing positive for the virus, we are recommending that they do wear the mask when they're in the house. Initially, when we first found out about the COVID-19 virus and when it initially started to reach the American shores, we weren't recommending that at first. But because of the surges that we had, I think at this point we probably have three or four by now. We're currently in the midst of one with 364,000, over 364,000 Americans dying to date, and over 3,800 Americans dying just within the last 24 hours. So it's definitely crucial that we continue to wear our mask to protect others. So the other person across from you wearing your mask is providing more protection for you than you're wearing than you are for yourself. And in similitude, if you're wearing your mask, you're providing more protection, for them and others. And so we made some recommendations, and the Department of Public Health made some recommendations and gave guidelines about, especially if you live in the house with other people, it's important if you test positive to wear your mask even in the house, and to quarantine. That's a part of quarantining and physically distancing within your actual home environment, especially if you're around elders, especially if you're around people who, if they get the virus, have the potential to become sicker, even than you are when you develop, mild to moderate symptoms. So, wearing masks is still very crucial. Even, after we've started to vaccinate healthcare workers and nursing home residents, it's still going to be very important until we achieve herd immunity.
Mhm. Um, Now, and this may be jumping ahead of you, and you can let me know if it is. But say, for instance, once someone, have been diagnosed with COVID-19,
Mhm.
and say, for instance, they call you because you're around them Monday and it's Wednesday, and they say, "Hey, I've been diagnosed, or I was tested positive." So you hear so many different things as to when you should get tested. So if I was around somebody on Monday and it's Wednesday and they call me, do I wait to get tested, or should I go ahead and get tested now? Because I know I've heard they say you should wait 3 to 5 days, after you've been exposed, around somebody that's tested positive. Can you clarify how long we should wait before we get tested? Because, could we get a false negative or false positive or?
Well, the latest I've seen about the incubation period for the virus, sometimes it's 3 to 5 days, sometimes it's a couple of weeks. It depends on the individual person. But this is a very individualized virus in terms of how it affects the individual person. We've never really seen anything like that before. I'm a young doc, and I've spoken to more senior physicians who have been practicing medicine for 20, 25, 30 years. They've never seen a virus do what it is doing, the COVID-19 and what this novel coronavirus is doing to people.
Mhm.
It's different. It's different in that, if we have influenza can have, has a certain disease pattern that we could recognize in people. We know that, if patients have, certain medical conditions and they're immunocompromised, or if they have weaker immune systems, they may have a complication from influenza, um, that might lead them eventually to having pneumonia as a complication, streptococcal pneumonia as a complication of influenza infection. This one is different. This one is different in such a way that when it immediately hits certain people's lungs, it's causing pneumonia. It's causing a pretty significant viral pneumonia that can worsen due to that cytokine storm I mentioned before. And so I say that to say, to answer your question more directly, the incubation period in terms of when one person develops symptoms in comparison to another person may be completely different between the two. It's not following the rules. And that's what sort of makes us a little bit frightened by it. But we do have the capability with medical research to learn more and more each day. We are learning more and more each day. We have more information now about how it causes complications. We've heard of the long haulers, people who may have had the virus. They may have quarantined, they may have had mild to moderate symptoms. And then, here a couple of months after they initially tested positive and they've gotten over the majority of their acute symptoms, they're having some chronic issues with breathing. They have the most common complaint that I often hear in patients who I have now identified in my own practice as being long haulers is they say sometimes when they cannot, they feel like their lungs aren't expanding as well as they used to. And some other people mention that they feel like, those who had gastrointestinal symptoms, they feel like their stool caliber isn't the same as it used to be. So it definitely is a virus that writes its own program and walks to the beat of its own drum. And so, on average, you would be correct, and I think others would be correct when they say the 3 to 5 day range is where most people typically can say that they are going to be infected. They can wait out and wait until about that time after exposure to someone or after getting that call to be tested. Um, but with the advent of point of care testing, which we did not have at first, patients do have the capability now to be tested and get an answer same day. So now, a lot of times, if patients just want the test, we were really, really holding on to the test previously when we first started to get them for patients who were primarily symptomatic. But nowadays we have the capability to do almost like a flu test or a flu swab. We can just go in and just tell the patient, just if you feel like you want to be tested, just go get tested. And within our health system in the primary care offices, we primarily have still the diatherics or the PCR test, where we just do the nasopharyngeal swab, and it takes 48 to 72 hours to return. Our urgent cares in our system have the point of care testing, where if the patient calls and they say, pretty much what you just said to me, I say, well, if they have certain medical conditions, I tell them to go ahead and get tested. Otherwise, I just tell them to just watch themselves for symptoms. If they start to develop respiratory symptoms, fevers, chills, cough, sputum production. It is true that coronavirus causes olfactory or the ability to smell dysfunction, where patients lose their ability to smell and taste. If they have any of those symptoms, just watch themselves for it after exposure and call us back. And if they want to be tested, they definitely can.
Okay. That's good. That's good. So would you say, like, say for instance, for a couple that are that's in the same house and one of them tests positive, um, would you say the partner, even though they're not showing symptoms, um, should they go ahead and get tested and just assume they're positive? I know we're telling them to quarantine, but would you as their doctor say, well, because your husband has it or your mate has it, you need to be tested? Or would you just say, well, just assume and just quarantine?
Not necessarily. They don't necessarily have to be tested. The appropriate thing to do would be to just quarantine, and the person who tested positive, the partner in the relationship who tested positive, should most of the time they will come. I'm just going to tell you, in the real world, because the real world doesn't always meet the textbook's definition, right? So in the real world, they're going to come into the office together
Mhm.
and be tested. Um, the textbooks pretty much say just tell the other person, who tested positive, to quarantine, maybe sleep in another bedroom for 10 to 14 days, and just watch their symptoms, wear their mask, practice adequate hand washing when they touch surfaces, usually 20 seconds at a time. I often tell patients you want to get between the the fingers under the fingernails and above both wrists, because we always learned in medical school that it's the friction and not necessarily the temperature of the water that dislodges microbes from the hands. And just making sure that they're wearing a mask at home. That's really the best thing that they can do. If the other spouse who does not yet have disease or have an infection with COVID-19 develops symptoms, they can certainly come in and be tested. But we have the capability now. We're not holding on to those PCR swabs like we did initially because of a very small supply and rationing of those supplies to medical offices and physicians' offices and practices. We do now have the capability to test more and test more frequently and get results, more quickly than we did in March of last year. So if they want to test, we do it.
Okay.
So that's no longer an issue like it was initially, and that speaks to the fact that we have more information, we have more capabilities now than we did almost a year ago.
Okay. And I'll ask this and then I'll let you move on to whatever segment you want to move into. So once someone has been diagnosed, they've been treated, they've quarantined, what's your general practice like as far as retesting? Do you retest them? Do you retest them after a certain amount of time? What's your, being in the primary care setting, what's your practice on that?
The real answer to that is what we see in the real world every day. And so I have had some patients, test too frequently. They get tested on Monday. By Wednesday afternoon, they want to be tested again, and they tested positive on Monday. And so I often tell them, there's no need to, if you test positive, to test again so quickly. You need to quarantine, monitor yourself for symptoms. Let's see if we need to treat. Let's see if we need to eventually send you to an emergency department for, higher level evaluation for possible admission if your symptoms worsen. And I usually tell them if they want to be, because some jobs do require that. And so if your job requires you to be retested before you return to work, I tell them pretty much to wait for the full 14 days to do so. So try not to test yourself too quickly, because your test is expected to continue to be positive as long as you continue to have symptoms, for those who test positive and for those who have symptoms. So there is, more information coming out about how quickly we should test people. We don't have all of that yet in terms of what we need to do and what we need to educate people who have specific medical conditions about, in terms of how frequently they need to test after they initially test positive. Someone who tested negative the first time, if they feel like they have symptoms again, they do have the capability to test again. The following day in a couple of days. Some people, are driven by anxiety, which is one of the unspoken pandemics of the COVID-19 pandemic, the mental health pandemic. And so, people do have a tendency to probably, leave one doctor's office and go to another and get tested again, or drive over to CVS or go to urgent care to be tested. A lot of times that's not necessary. We do have to, maintain some degree of credence in our tests that we do have available, and they are really good tests. The gold standard is still the PCR test, the nasopharyngeal swab, which we were doing initially, that takes 48 to 72 hours to return. A lot of times what they'll be doing in urgent care is if they'll do the point of care test first, and if there's a high clinical suspicion that the patient still does have symptoms consistent with COVID-19 disease, they'll follow it up within the same sitting with the nasopharyngeal PCR swab. So that's just what I see most of our urgent care physicians doing within our health system nowadays. But if you test positive, quarantine, physically distance, monitor yourself for symptoms, worsening symptoms, stay in close contact and communication with your primary care physician. And, after, your quarantine period, it's certainly okay to test again before you return to work-related duties. And, if you continue to test positive, of course, you'll have other discussions thereafter. But if you test negative, all systems go and you're good to go.
Okay. So I think we should go ahead and segue onto the big topic,
Okay.
which is vaccines.
Okay. Absolutely.
Because, even before, COVID vaccines, the flu, we were entering into flu season time. And you have people that, Lord have mercy, you almost have to pull their teeth to get them to take a flu shot. So now you talk about a vaccine that people feel it took 2 days to develop. I'm just, I'm just saying. But that's how people are talking about it. Like it took 2 days to develop. So they're like, I don't know that because they just developed it. They ain't had time to work out all the kinks or whatever. So if you don't mind, let's hit on that topic because like I said, as I was sharing this information, I want people to have as much information as you possibly can share, so that they're able to have somewhat of an informed decision from that. I'll say that for me, I had been back and forth, in the beginning, I kept saying, no, I ain't getting that thing. No, because I was like everybody else, it was quick. But then, after talking to my oncologist and just as the numbers kept going up and the death rate kept going up and working in the healthcare field and seeing patients after COVID, the patients who actually survived COVID and actually had to go on ventilators and, come out having to learn how to eat again, having to learn how to walk again. And just the fact that, like you said, patients who were healthy or some that were not healthy now are oxygen dependent. They can't even eat without needing oxygen. They can't even take a step and go to the bathroom without needing oxygen. So just that reality check for me, when my job said we're going to have vaccines, I was like, I'm on it. I sign me up. When can I get it? Because also I think, and not everybody's going to think this way, and we're not here to persuade people one way or the other about the vaccine. We're just trying to give you guys information. But I think for me as a healthcare provider, I think we are here to help others. So sometimes we have to make sacrifices, to help others. So I was like, if I'm going to be out here trying to tell patients how to take care of themselves and protect themselves against this virus, I need to lead by example. Not everybody feel that way, but that's just the way I felt. Plus, on top of that, I felt like that will help me, but I'll be helping my patients and my family as well. So just, if you don't mind, so I did get the vaccine on yesterday. And it wasn't bad at all. It's just like any other vaccine as far as the injection site. If you've ever had a shot before, there was pain in my arm, but that's with any shot. Yesterday I had no issues. Today I had no issues whatsoever. They do have this text thing that you can join. So they will send you out text messages so you can let them know if you're having symptoms or not. And that's the way they're tracking, patients once they get patients and healthcare workers, once they're getting the vaccines, they're able to come up with symptoms that people may be having. But for me, like I said, I got it yesterday. I'll get my second dose in 2 weeks and no problems whatsoever. So I'll let you take the stage now and talk about the vaccine and if you've had it, what experiences you may have had or whatever.
So thank you for sharing your individual story, Lakeitha. I think it has the capability to help a lot of people. And there is no aspect of our society that, that has not been impacted by this virus. In my own family, I had an aunt who was on a mechanical ventilator for 2 months, um, cytokine storm, who had chronic medical conditions. She lives in rural Georgia, and she's thankfully and prayerfully survived. And her voice is different. She's on oxygen. She had pretty significant pneumonia, what we call in rural Georgia double pneumonia, what we in medicine call bilateral pneumonia, and she has thankfully done well. But she's different in terms of her voice, but she's pretty much the same person. Had other family members who tested positive for the virus, who were trying to do everything that they knew to do to protect themselves. Right? They were physically distancing, they were socially distancing, they were wearing their mask, they were doing everything they were supposed to do, frequent hand washing, and they developed mild to moderate symptoms. Both of them who come to mind initially, had loss of smell, loss of taste. Had another cousin who was hospitalized, younger cousin who works in healthcare who was hospitalized. So this virus has affected all of us in some way, whether it be affecting us personally, our physical bodies, affecting our families, affecting our money, our bank accounts. People have lost their jobs, affecting our minds, causing anxiety, depression, which we continue to see in the medical primary care office every day. So therein lies the impetus, if you will, the basically the reason why we should want to prevent its spread, and the reason why we should want to eradicate it in whatever way that we can. So I got the Pfizer vaccination, and let me step back. There are two vaccines that have been approved within the United States for emergency use authorization by the Food and Drug Administration, by the FDA. And I know it seems like, the process was quick, but the process was quick because we needed it immediately. That is not to say that these vaccines did not go through, most vaccines take years to develop, right? But that's not to say these vaccines did not go through the same trials that were necessary for them to go to ensure safety and efficacy in the population. We all hear about the trials, the phase 1, phase 2, phase 4. Initially, there are animal studies. The phase 1 trials, just as a quick overview, is to determine if there is safety of what is being offered for authorization by the FDA, vaccines, medications. So the phase 1 trials offer information about safety. And usually they're studied in, pretty healthy people in a very small group, like dozens of people, maybe like a couple of people. Phase 2 trials help us determine if what amount of the drug or what amount of the vaccine is going to stimulate the desired effect. And the desired effect is a immunologic term. We term immunogenicity. What dose, what amount will stimulate the immune system's response that we want from a certain drug or from a certain vaccine. And phase 3 trials have more people, and these trials, these phases are a summation of the previous phases that have been passed. So they still continue even at phase 3 to look at safety. They still continue to at phase 3 look at phase 2's primary goal of what dose, what amount helps to provide the immunogenicity that we want. And phase 3 helps us pretty much determine, is it effective? Is the amount that we have shown that's safe, and is the amount that we have shown that is that provides the immunogenicity, is that amount effective to do what we want it to do in a larger amount of people, and a larger amount of the population? And many of these studies and these trials include people who are relatively healthy, so as not to confound the results, so as not to basically muddy the waters in terms of what we want to see. So these vaccines that have been approved for emergency use authorization in the United States have gone through the rigors of those trials. And I often tell patients the same thing. One of my mentors and said before that the African Americans were included in these trials. About 10 to 12% of individuals included in these trials were African American, and the developer of the vaccines and the head of the Vaccine Research Center at the National Institutes of Health, Dr. Kismika Corbett, is an African American. So she made sure that when these, and Dr. Fauci, they made sure that when we were studying and developing these vaccinations, that these vaccines included people from all areas of all facets of American society. The specific populations of patients and individuals where we do not have enough information yet to determine if they should receive the vaccine are pregnant women and those who are immunocompromised. So we need more data before we can, in large amounts, say, pregnant women can get the vaccine at this, area, this trimester of pregnancy, or patients who are cancer patients currently undergoing chemo or chronically on steroids, or people who are just immunocompromised for whatever reason. HIV/AIDS patients, they cannot. We have not received enough data yet to encourage vaccination in those populations of patients. The Pfizer vaccine and the Moderna vaccine, Pfizer BioNTech vaccine and the Moderna vaccine have been approved for emergency use authorization in the United States. And Pfizer and Moderna both are mRNA vaccines or messenger RNA vaccines. And that's a fairly new technology so most vaccines that are developed, they have a certain amount, usually DNA or some other genetic material, usually DNA, genetic material within a viral capsule, and that contains an inactivated or live form of the virus that we want the body to develop antibodies against, right? So basically what a vaccination is, it's exposing your immune system once you receive the vaccine to usually genetic material, either live or inactivated from a virus, and is stimulating your immune system to develop proteins that attack the virus. So you don't necessarily, when you get the vaccination, have to be someone who has had an infection with whatever the pathogen was before. We don't want you to develop a natural progression or a natural response. We want you to not even have symptoms or to get that infection. And so therefore, that's where vaccines come into play. The Pfizer BioNTech and the Moderna vaccinations are a little bit different in that they do not contain viral genetic material. They don't contain DNA. They're not DNA virus. They do not have live or inactivated forms of the coronavirus. What they actually have is messenger RNA. And what is messenger RNA? Messenger RNA pretty much is a type of genetic material messaging that when you receive the vaccination, it tells basically and writes the instructions for producing either a protein that's specific to the COVID virus or a some sort of particle. And that specific particle we often hear public health experts talk about is called the spike protein. The spike protein is very specific to the COVID-19 virus in that it is that component that basically allows the virus to attach to and infect cells, particularly in the respiratory epithelium all throughout the body, and allows the virus to basically take hold and causes the disease that it causes. Well, the messenger RNA in both of the vaccinations that we have available right now in the United States basically writes the instructions for the body and for the cells in our body when we receive the vaccine to basically produce the spike protein. And it produces the spike protein, which stimulates our immune system to develop antibodies against that spike protein, therefore providing immunogenicity and providing us the capability of being protected against getting the COVID-19 infection. Now, both of those vaccines have been shown to be over 90% effective. And the Pfizer vaccination is 95.1% effective, and the Moderna vaccination is 94 and some change percent effective. So they're effective. Now, that is not to say, as I so often tell patients, that when you get the vaccination, there are no side effects. Now, whenever anybody injects you, you do have, the capability of getting some pain, some swelling at the injection site. That's common with just about any other vaccination that you receive. Occasionally, patients can get, especially with the second dose of both vaccinations, you can get some chills, headache, muscle aches. Sometimes patients may say that they feel febrile. That has been reported. But a lot of times that's just the results of getting that second dose of those vaccinations, which is what is expected actually. So it doesn't necessarily mean that if that's happening to you that you're getting sick, but we are really encouraging patients with the history of severe allergic responses to just about anything to probably, have further discussions with their doctors before they decide to get the vaccination. And that's anybody, even if they are not pregnant and even if they're not immunocompromised. So have some additional discussions. After you receive the vaccine, CDC is recommending that patients and the ACIP are recommending that patients be monitored for at least 15 minutes. Those who have a history of severe allergy should be monitored for 30 minutes if they decide to proceed with the vaccination. So just to make sure that there's no severe allergic reaction or response to getting the doses. The Pfizer doses should be separated by 21 days, and the Moderna doses should be separated by 28 days. So 3 weeks and 4 weeks. And then after that, you're protected and you're good to go.
I see a couple of questions in here. I'll ask you those. Before I ask you those, I wanted to see, because I know yesterday when I was getting my vaccination,
Mhm.
the nurse that was giving them, she was from the health department, and she mentioned something about if you had recently been tested positive for COVID-19,
Mhm.
she said you can either go ahead and get the vaccine or you can wait for a certain, I thought she said 90 days,
Yeah.
but because of the antibodies, I guess that your body's already produced, you're already protected. So, you just wait and allow those antibodies to settle and then get the vaccine, or?
Right. And that's exactly right. So, those who have the infection will probably have the antibodies for up to 90 days. I think when we were initially having discussions about, and the data initially said that they lasted for 46 weeks. And then after that, the latest information about how long the antibodies last is 2 to 3 months, actually. So that's why we are recommending, and all of the recommendations from CDC are suggesting that those who had COVID disease, mild to moderate COVID disease first, and if they've gotten over that, wait for 90 days to ensure that the antibodies are completely gone, because these are not permanent antibodies. These are antibodies that remain for a period of time. And then 90 days is the mark at which you can definitely proceed with getting vaccination, either the Moderna or the Pfizer vaccination. So that is correct. The 90-day mark is where we usually tell people to wait to.
Awesome. Okay. So one of the questions I see is someone asked, is it safe that they have you to test yourself when you go to take the COVID test?
So I think what that individual is referring to is like when you drive up to a CVS
So,
and you can basically swab yourself. It's safe to answer the question directly. It's completely fine as long as you follow the instructions that they give you about, cleaning your hands and wiping down the receptacle box that they have there for your test. The other question that people usually have is it effective?
that's
Because
what I was about to say.
a
Yeah.
lot of times patients do, and individuals, they flinch and they flinch while they're getting while they're trying to admit when we try to do the swab on them. But
Right.
imagine what they're doing when they are trying to do the swab on themselves. And the question is always, are you getting an accurate um, amount to basically get a result? The other question there usually is going to be, is it safe if I'm in the car with someone else? Well, ideally, you might want to do that by yourself because you don't want to be coughing and sneezing and flinching and spewing respiratory particles around someone else in the car with you, especially if you are positive for the virus. So I would encourage patients and individuals, if they go and do that themselves, it might be best to just go alone and not go with others in the car with them to protect those others individuals from being infected with the virus if you in fact do have it. So, but it's completely safe otherwise. If you always have concerns about whether or not it's accurate, you can always follow up with another test with your own primary care doctor. Just follow up with a PCR test in the office that's performed by a healthcare professional who's going to try to make sure they do it in the standardized way to get an accurate specimen.
I think if I think the rule of thumb is if you're giving it to yourself
Mm.
and your eyes don't water or you don't feel the urge to sneeze or cough, you didn't go far enough.
It, 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 it,
Because it should be uncomfortable,
it,
right, Dr. Stewart?
it should be uncomfortable. It's going to feel like a pinch on the inside in the back of your nose. That's
Mm-hmm.
what it feels like. And if you don't cry a little bit, then you probably haven't hit the right spot. So you got to cry. So you got to try to cry. That's what I saw say.
Yeah, because I know each time I've tested twice, and each time my eyes watered, and it just, oh my gosh. So yeah, if you don't get that reaction, then it's not far enough.
Yeah, I had it once, and once was enough for me.
Yes. Another question was, can you get the vaccine if you haven't been tested for the virus?
Uh, Absolutely, yes. You don't. So to get the vaccination, there is no prerequisite to be tested to see if you're positive for it. If there is a suspicion that you're having symptoms and you're scheduled to get the vaccination, it's probably going to be important to get tested. If you have an inkling, you can. That's left to the individual person and patient's discretion, but there's no prerequisite to be tested before you actually have the vaccination. No.
Okay. Let's see if we have any more questions to come through. I know one of the questions that Pastor Baker had,
Mhm.
because his wife also is a nurse. She works in the healthcare field, and he was talking about, because you know how they're giving us the vaccine first. But his question was, and I think he said he may have heard, but he's not sure, about like, are they offering the vaccination to like the spouses of, healthcare workers to also protect them
Yeah.
at the, you know what I'm saying, at the same time?
That's a good question. That's a question that's always on our Zoom calls and teleconferences within our health system with the physicians. Like basically, when you go immunize my wife, and when you going to immunize my husband and my children. It's a matter of making sure that we have enough of the vaccinations to effectively and completely immunize those at highest risk first. So definitely healthcare providers, healthcare professionals, those on the front lines, if you will, those who are quote unquote essential, should take precedence in terms of making sure that, you know, we're going to be vaccinated first, because we're going to have to be the ones to remain healthy to take care of other people when they're sick in the hospitals and their offices and things of that sort. And then older people and people who are sicker and who are living in, you know, sort of communal environments like in nursing homes and rehabilitation facilities, they're going to also be the ones to get vaccinated next. And then I would imagine when you start to offer the vaccination to the population at large, that will definitely include healthcare workers. We don't have specific information about when that will be in our system just yet, but that's something that's ongoing in terms of planning and making sure the logistics are where they need to be. In our health system, we are hopefully going to be offering the vaccination soon, within the next 2 to 3 months, hopefully. You know, we don't know yet. Things are constantly changing and are in a state of planning. But our senior vice president of our medical group has mentioned that they are going to identify 12 locations within our health system, and patients can make appointments to get the vaccination series. So that's the way that they're doing. They're trying to be a little bit more structured. And honestly and truly, this is unfortunately differing from state to state. Um, I think Florida is adopting, and not to pick on Florida, I love Florida, but Florida is adopting a whosoever will let him come approach, where they're basically saying, you know, everybody over 75, if you want to come, just show up somewhere and get it, which I think can breed chaos. Um, and that's why you saw in the news, you know, a lot of elder Floridians just sitting outside for a couple of hours overnight with their blankets on in their little lawn chairs, and just waiting. Which I think it can be done in a little bit more of a systematic way, in a better way to make sure people. Um, it should be done, to borrow from church vernacular, decently and in order, right? So,
Yes.
and we are definitely taking that approach in our health system. And in the state of Georgia, it's definitely being affected in a decent and an orderly way. So we definitely want to make sure of that.
I see another question came in.
Mhm.
It said, um, how long should you wait to get retested if your results are negative, but in a couple of days you start to have symptoms?
Yeah. So if your results are initially negative, I mean, you can honestly and truly be tested as much as you want. I mean, considering the fact that um, there are certain stipulations on the tests that we have available. The point of care testing can be done, you know, as many times a day as you want. I mean, I don't know if you're going to want to be tested that frequently, just because of the test is
Comfortable.
rather uncomfortable. But you can get that done, honestly, multiple times a day. Do people do so? Probably not. The diatherics testing, where we do the PCR swab, it's a little bit more accurate. It's the gold standard. It usually takes 48 to 72 hours to return. So, you would initially wait on those results. And then, if you're not comfortable with them, if you want to be tested again, if you're concerned that you may have symptoms or exposure, you can definitely be retested again after those initial tests have returned. So, if you test negative and you have symptoms, you can just go ahead and be tested. But it depends on the type of test that's available to you and the type of test that you got before.
I have two questions, and then I'll let Pastor Baker say whatever he may want to say. But the first question that I have basically is, what are some supplements or some things that you would recommend people to do to kind of protect themselves now, as far as like their immune system or that type of thing? What would you suggest people do right now?
So we're seeing a lot of patients be discharged who are hospitalized with COVID disease on a combination supplement that has vitamin D, zinc, and thiamine in it. Um, I haven't seen a whole lot of largely powered medical studies with the large sample size to suggest any of that, but it's probably based on some small, low-powered studies. We practice medicine nowadays based on the evidence, and the evidence comes from guidelines, and the guidelines come from large studies or systematic reviews of which we can extrapolate that information and basically that medical data to large populations of patients. And so when a doctor is recommending something based on guidelines, you can rest assured that there's a lot of good research that is backing up that claim and that recommendation. So I would imagine as we continue to receive more data, as we continue to receive more information, and the research continues to ensue for COVID-19 disease, we're going to get more information about what we can do to basically protect ourselves. These are patients who have had the virus and who probably they started those supplements in hospital and continue to recommend those supplements when the patient's discharged. So in a lot of those discharges, I mean, that's what we're seeing. A good way to basically improve and ramp up your immune system's capability is eating well, fresh fruits and vegetables. The plate from CDC is, the recommendation for a heart healthy plate, a good plate is should be 50% fresh fruits and vegetables or plants, 25% lean protein, 25% carbohydrate. Exercise is important. 30 minutes a day for at least 5 days a week of moderate intensity exercise. That's anything that breaks a sweat. Common examples are heavy housework, yard work, and brisk walking. Basically remaining healthy. If you have chronic medical conditions like hypertension and high cholesterol, diabetes, chronic kidney disease, chronic heart disease, making sure that you take your medications to ensure that you're not ending up in a hospital, that you're not, that your immune system is able to, remain healthy and do what it's supposed to do to fight off this infection. Some people take vitamin C. It's been shown to, for years and years and years to potentially help improve your immune system's response to many things. Has it been studied specifically for COVID-19? No. There is a little bit more information about how vitamin D can help with, improving, your immune system's response to COVID-19. There have been some small studies that I have personally reviewed that have suggested that. Do I recommend it every day for patients to protect them from getting COVID-19? No, because I don't have a guideline or a larger power study to suggest that. And to give me that confidence to say that I can say that to all of my patients or specific subsets of my patient population in large amounts. So vitamin D deficiency is important to find out in any way because it does worldwide lead to a lot of increased mortality. So it's important to, just, keeping your doctor's visits, making sure that you're staying healthy generally. That's the best way to make sure your immune system is able to fight off this infection. And for those who have certain medical conditions, chronic medical conditions, they should definitely do that even to a greater extent to remain healthy and keep their chronic conditions like diabetes and high blood pressure under control.
So I guess as we get to the end of the conversation, like I said, it's definitely not our intention to sway anyone one way or the other, whether you should get the vaccine or not. Our goal was to just come on and share, the research that Dr. Stewart has studied and looked into, as he provides care, in his practice each and every day. And so I guess what I would ask of you, Dr. Stewart, not to be, biased or whatever in any kind of way, but if you had to give pros to the vaccine, what would you say some of the pros would be in your medical opinion to getting the vaccination?
I think it will definitely protect um, large amounts of the population. It'll help keep people alive, um, loved ones that you care about, um, neighbors that you love, church members. It will help do that. We do know when the virus initially broke out and started killing people in Albany,
Mhm.
black people.
Mhm.
Um, it would the source of that was two funerals. And
Yeah.
you know, when we go to funerals, we go to funerals, right?
Yeah.
Because you know, a lot of people know the same people, and it really in small towns that are predominated by African Americans. So, you know, these vaccines that we have available, right, have the capability of keeping that from happening in the future. And a quick word about the new variant. We now know, you know, there was some speculation that, you know, way back when this virus first hit the United States, is it going to mutate? Are we going to have to get, um, you know, a booster vac? Are we going to have to get vaccines, you know, every year for this like we do for the flu? That still remains to be seen, but we do know that um, the variant first appeared within the United Kingdom. I think there has been a mention of variant in South Africa, which is different than the one in the United Kingdom, I believe. And the UK variant has been found in Colorado initially, California, Florida, down near Miami, and now it's in Georgia. We don't know where in Georgia, but it has affected an 18-year-old who is quarantining at home. So it's here. The question usually comes, well, if I get the vaccination, will it protect me from this new variant? The short answer is yes, because we do know that the spike protein that I mentioned, that the messenger RNA codes for when we get the Pfizer or the Moderna vaccination, it does not mutate. It has not been shown to mutate. So the virus is mutating in other areas of the actual viral particle, not the spike protein. So that's why the discussion has ensued and the recommendation has come that, for as far as we know, the vaccinations that we have available to us right now will protect us from the variant. And the variant has been shown to be more contagious and more transmissible than the initial variant of COVID disease. So it's going to be very important to get the vaccination. So I'm all for vaccinations. Um, I've studied the data myself. I've looked at it because I have to as a physician to be able to educate my patients about it. I ask patients every day since we have the vaccines available, since we have the Pfizer one available, do you have questions for me about the vaccine? Some of them just bluntly say no. And then some of them do have legitimate questions to help themselves make the best decisions that they can. Um, so I'm for them. I think they have the capability to save lives. I mean, that's the reason we're having this discussion. That's the reason that they're developed, and that's what we want them to do, right? So I do think it'll be good to get them for those purposes.
Pastor Baker, do you have anything you wanted to ask the doctor?
I don't have anything to ask the doctor right now. Besides, put me one of those vaccines to the side. I'm gonna be at your door waiting on it.
All right, all right,
Um,
all right, all right. We got you.
yeah. I thank you so much for all of the information you've given us tonight. It's been a lot of good information, a wealth of information. Thank you, Mr. Lakeitha, for coming on and um, helping us to get through this conversation. Um, Dr. Stewart, one of my pastor friends, he's been bombarding our comment field tonight. He
Uh-huh.
want to know if I'm going to get the vaccination. So I believe he said he's going to get it too if I get it.
Right.
So that's two pastors that's ready to get this vaccination. But I definitely believe, again, we didn't come on here to persuade anyone, but I do want to encourage anyone to definitely think about this. If you know it can be beneficial,
Yeah.
hey, think about your families, think about your loved ones,
Yeah.
think about those that mean a lot to you. And so I'm openly letting everybody know as soon as I can get it, I'm going to be getting the vaccination. So again, thank you. Thank you for your expertise, and thank you for the work that you all do being healthcare providers. I also believe, I'm an essential worker. I believe my household have two essential workers,
Right, right.
uh, nursing field and having to pass. So it's very important for me to do this because I still put myself out there going around certain members, my grandparents who are elderly and these different things. So again, thank you for coming on tonight. I think that was all the questions.
One more that popped up.
I just want to say quickly before we answer that last question, apprehension is normal to the human condition, right? When something's new, um, we have the capability and the license and should be anxious, should be apprehensive, but that should also stimulate the desire to learn more about it to make appropriate decisions that
Absolutely.
affect our own health. So education is very important, and that's why we're here tonight to educate, and not only to educate, but with education comes empowerment and
Yeah.
making sure that we appropriately give people the information that they need and meet the people where they are so that they can make appropriate decisions that affect their health and the health of their loved ones. That's why we're here tonight. We're not here to coerce anybody to do anything and to get anything. And in our community, there is a long-standing tradition of being apprehensive about medical procedures and treatment. I
Absolutely.
mean, need I mention the Tuskegee syphilis studies? Need I mention
Mm,
Henrietta Lacks? Um, those were terrible times, but a lot has come out of those unfortunate situations that have changed medicine for the better and that have changed us as a community for the better, where we should not, we should ask questions. We
Yeah.
should be skeptical. We should read. We should want to learn more, but we should also want to be healthy and live a long, happy life as much as we can. And so I thank you, Pastor, for your ministry to people, because I feel like I'm able to do what I do every day because of the help of the good Lord. So, and I say that unapologetically and
mm,
without fear of contradiction. So, thank you for ministering to the physical needs of people as we minister to the spiritual needs of people as we minister to the physical needs of people. And so, the church has been an important mainstay in terms and institution in educating our people about their health, even. So that's why I wanted to make sure we had this discussion and basically utilizing the resources of the church to get the word out.
mm,
That's what we have
mm.
to do.
And if we want to get back in the church, as everybody keeps saying, they miss that environment so much.
Man, I
It's
miss
important
church.
that we
Listen,
do what is necessary to get back in the church.
I mean, people know I'm a church boy. I miss church. I sometimes on Sunday I just look at my suits and I'm like, well, should I put one on and just go somewhere today?
Put on one, Doc, and
But
go.
I don't do that. I do watch church as at home, but I miss it. And I think a lot of people who have been on the call with us, who have been watching, also miss their churches and also miss being in the fellowship of the saints. So it's going to be important that we protect ourselves and remain alive so that we can make it back to the sanctuary and the temple. So that's the word.
And before we go, I'll hit this last and final question and then we'll close out and we'll be done. But the last question that popped up on the screen said, can you still get the virus from surfaces or is it just airborne?
From what we know about this virus, it is primarily an airborne virus. So now, if somebody sneezes on the surface and you touch it, and they had the virus, you're probably going to get infected, especially if you touch areas on your face, your mucous membranes. If you stick your finger up your nose, if you scratch your eyes, with that amount of a medical term that we use, inoculum, with that amount of virus uh, in that substance, you can definitely get infected. But primarily, it is an airborne pathogen. So which makes it a little bit more dangerous than pathogens that spread by contact. So that's why masks are important. That's why social and physically distancing is important to protect you from that airborne transmission.
Awesome. Well, I think that's amazing, 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 Dr. Stewart. Like I said, thank you so much for your time. I thank you for your wealth of information. I'm hoping that people took the information in and that they will use it, and allow them to make the right decision for them.
My pleasure.
Whether they decide to get the vaccine or they don't, or they decide to wear the mask or they don't, but like we said, if you want to get back in those four walls, you got to do what you got to do.
That's right. And remember, Pfizer is 16 years of age and up, and Moderna is 18 years of age and up. Okay.
And it's interesting because you got Pfizer and I got Moderna.
Yeah.
So we shall see, we got different vaccines, so we'll see.
Yep.
Yeah.
Well, Doc, get your good suit ready, man. When New Mount Carver open up, man, I want you to come visit us.
I will come. I will be there. I will be there 5 minutes early, and I will not walk in just when you're about to preach.
And I want to say, everybody, be on the lookout because Dr. Stewart and I will be getting together for another conversation that's very, very important, that I think is very, very important. So just be on the lookout for another discussion in the very near future from myself and Dr. Stewart. That's going to be very beneficial to a lot of people.
Absolutely. Look forward to it.
Let us pray real quick, Dr. Stewart and Lakeitha. Our God, we thank you for this opportunity to come and to hear wisdom from Dr. Stewart. God, as we look in the wake of our nation, we still trust and we believe you. And so, God, we also want to believe in those that you have given wisdom here on earth. And so, God, we thank you for this platform. We thank you for those who tuned in and those who listened. We continue to pray for those who have been affected directly and indirectly by COVID-19. And so again, God, we just thank you for this wisdom. Let us take it and share with our family, with our friends. Let us also be concerned about each other. Let us continue to wear our mask and do those things, God, that we can control. But those uncontrollable, gods, we want to leave it in your hands. And we want to give you all the glory and all the praise for what you've done for us and how you've kept us. And I pray for Lakeitha and I pray for Dr. Stewart as they continue to do work in the healthcare fields and those others, many of others who continue to work in the healthcare fields, God, that you continue to cover them and keep them. It's in the name of Jesus we do pray. Amen. Amen.
Amen.
Thank you. God. Thank you, everybody. Y'all have a good evening.
Thank you all. Have a good
Dr.
evening.
Stewart, have a good night and be safe.
Thank you. You too. Good
Thank
night.
you. Good night.